Welcome back to Author Master Insights. I am with Dr. Leonard Faye. This is an incredible opportunity to learn from a true master of our profession. Dr. Faye, welcome.
It's a pleasure to be here. Thank you for inviting me.
I'm very excited for this conversation. And before we get into the conversation about your book, and really also about the incredible history in chiropractic you have, I'll share a little bit for those not familiar with the amazing, truly amazing contribution you've made to chiropractic. Dr. Leonard Faye has delivered over 400 seminars worldwide, and everywhere he goes, there are doctors, both past and present, students and chiropractor masters that remind him and acknowledge him and really provide recognition for the impact that he's had upon improving their professional and personal impact and success. He is a doctor of chiropractic and a true legend of our profession. He has single-handedly changed the way chiropractors assess and treat joint systems. He's revolutionized the thinking in chiropractic by delivering the concept of motion palpation and started the Motion Palpation Institute, yes, that organization in the 1980s, teaching his methods to thousands of chiropractors around the world. And beyond his 50-plus year career in chiropractic, it has been Dr. Faye's crusade to get chiropractors to view the joint system in a three-dimensional functional system. And he documents this story, this incredible journey, in his amazing new book, Chiropractic Odyssey, A Journey of Practice, Seminars, Observation, and Reading Science, where he chronicles his long journey of organizing his and others' thoughts into an assessment and treatment style of the dramatic joint system. It is truly an epic journey that you've been on, Dr. Faye. It is so humbling for me to have this opportunity to share with this audience the incredible message you have.
Although I was against chiropractic as a religion, I was a real evangelist for the functional model.
Yeah, that's a beautiful way to start. Let's start. I mean, we're going to talk about your book. And actually, before I do, for those not familiar with Amazon, you can get it there as the digital copy, or you can go to Dr. Faye's website to get the physical copy. In either case, this is an incredible read. And we're going to have a conversation with your permission, Dr. Faye, not only about the book, but the incredible history you have. So before we jumped onto this call, you were talking about some of the conversations you've had and the impacts. I'd love for you to just share a little bit of your journey through chiropractic before we begin.
Well, I was in Australia 4 or 5 times. And the first time I went, it was a house in Sydney run by an osteopath. And the students took anatomy, got a degree in anatomy, and then came over to this house where this osteopath was teaching osteopathic manipulations, and it was being called chiropractic. I guess there was a better law for chiropractors. I don't know what but it was really interesting to present to them a model where the nervous system was the goal of adjusting and manipulation. We were trying to establish normal nervous system, not one that was pinched, but probably facilitated. And therefore, the manipulations were based on reducing the facilitation and recognizing that the spine is inside of a closed kinematic chain. So you can't just deal with the spine only. It's impossible because it's being influenced by the hip joint, the knee joint, the cuboid, the pronation of the ankle, anything that's in the closed kinematic chain that isn't functioning properly reflects itself into the spine. So you could be trying to change some spinal dysfunction that's really coming from a hip dysfunction or whatever. So that was a whole different concept, and people had trouble with that because spine only, hands only was kind of the euphemism of the time. And so my journey started in 1962, 63, when I was in England And the 37 chiropractors in England decided they were going to start a chiropractic college. And most of them were upper cervical. And so one classmate of mine, who was also in England, and a Lincoln graduate who actually wrote a book on manipulation, Ray Broom, we insisted that we drop this subluxation nonsense and above down and inside out and all that, and start trying to make it into a scientific endeavor. But there was no science at the time, so it was very difficult. But anyways, I delved into the books from manual therapists in Europe, physiotherapists, others in England who were medical doctors but did manipulation, that wrote books like Manel. And I had a really good basic training at CMCC of 1,500 plus hours of manipulation. So I knew how to manipulate the spine, extremities, any which way, but I just didn't know how to diagnose what to do and when to do it and how often to do it. And I bought about 1,500 pounds worth of textbooks up at Foyle's bookstore in London. I had 2.5, almost 3 years to prepare a curriculum for the Anglo-European Chiropractic College. And Dr. Ray Broom was going to do the clinical examinations, etc. And Jim Skinner was going to do the neurology part of it. And we actually got the hole-in-oneers to allow us to make that the curriculum. And then we hired a guy that had a master's of science chiropractor, but he was a Palmer teacher. And we insisted that he never mentioned subluxation, above, down, inside out, or any of that philosophy, which wasn't a philosophy. It was just bad science. And sure enough, by Christmas, we discovered that the students were being fed all this nonsense and they didn't want to learn the science. So we fired him, and every student left for America except one. And we kept that college going for 3 years, teaching one student. All of us were driving hours to get there and spending a day there. And he was so miserable, he hated us. But we graduated him, and he ended up in practice knowing how to do what he should know how to do. And some of those that deserted to America, one became the president of CMCC. And she used to, when I would meet her, she knew what she had done was really bad, because CMCC was on a mission to get the science into chiropractic. And we were attempting to do that, and she left and almost sunk us. But anyways, that's kind of my story, and that's how I got into teaching and got on this mission, which I described the whole mission in the book. All these people I met that were leaders, that it was a very interesting mission.
It's an incredible story. I mean, the Chiropractic Odyssey makes a perfect way of describing it, because you have had an incredible lifetime in chiropractic, and you know, your journey to bring forth the science. And again, we spoke before we had this conversation about the need to move away from the hard bone on soft nerve model, which has no scientific defensibility, and your movement alongside Professor Carrick and the work that the Carrick Institute has done to create functional neurology as a foundation for chiropractic.
Yeah.
Talk about the role of the nervous system in chiropractic and the research behind it, and how significant this is for chiropractic?
Yes, when I graduated, there wasn't one PhD chiropractor. Now there's 34 of them in one college in Denmark, and they're all over the world. They're in every college, lots of PhD DCs. And now we have to get them out of the concept that an RCT is the only evidence. And experience of the practitioner is valuable evidence, but they don't consider that as a scientist, that experience is valuable. And my book is all about this argument. And I cite a lot of references that students aren't hearing about, aren't reading, and they should be, because we need to treat patients that we can't cure. We need to treat patients that we can help have a better quality of life. What if medical doctors only treated people they could cure? Well, they wouldn't be treating very many, but they consider it an honorable thing to help somebody have a better quality of life. And that should be our philosophy. And the book goes into this whole discussion, and it engages the reader so that when you're reading it, you're looking at yourself and you're trying to decide where am I on this chart.
And
it's a really important thing to do.
It really is important. And I'm interested in what you said there about randomized clinical trials and versus the experience of the chiropractor. For example, I know the Australian Spinal Research Foundation has begun delivering case study recommendations where chiropractors do their case studies and they facilitate the publication of case studies through the Journal of Asia Pacific Chiropractic. And what's fascinating now is that there is this great body of knowledge showing the clinical effectiveness of a chiropractor without an RCT. So is this what you're talking about, is using the expertise of the chiropractor to demonstrate the power of chiropractic to bring about change?
Yes, we need pragmatic studies. And Denmark is just doing one now. I like to think that I stimulated them into doing this. They call me a rebel, but I think the fact that they're actually doing a pragmatic study where they take low back pain patients that have a Faber positive test. So they have a restriction of the hip joint, and they're going to see if they don't treat the hip as well as the low back, how do patients do compared to those treated with restoring the hip function as well as the low back function, and how does that affect their chronic low back pain? And this study is designed apparently to be 5 years of observation. So they're really serious about it. They're going to get thousands. You know, in Denmark, they're all government organized, and so they can conduct a study like that in clinics all around Denmark, and they can have practitioners that know how to adjust the hip. One of them just wrote a paper about 2 years ago to get his thesis for his PhD on non-surgical treatment of hip dysfunction, osteoarthritis being one of them. And very interesting paper, but I'm sure he will make sure that everybody knows how to do hip manipulation and exercises, etc., to restore that function back to normal. So that'll be a really important pragmatic study.
That's wonderful that we bring pragmatic. I mean, the RCTs are important, but they are not the only aspect of research that helps understand the chiropractic story. And in your book,
Yeah.
again, you've titled, I love that again, coming back to the title, Chiropractic Odyssey, a journey of practice, seminars, observation, and reading science. I'd love for you to talk about what stands out most, given you have seen so much. 50 plus year, career is an incredible legacy.
It's 61 years now.
61. Oh my gosh, it's incredible. I feel so grateful to be able to bring this history to this conversation. What stands out most significantly for you over those 61 years, what you've observed in that movement to functional neurology and understanding that the nervous system is integral? What is probably your most significant observation, and that science is now saying what we've always known can be observed?
Well, I think it's ironic that now that we're becoming more scientific about what we're doing, we're dropping the skills of palpation and manipulation. And whereas I had 1,500 hours, 2 hours every day for 4 years, and today they get 450 hours of manipulation, and they're still teaching systems, the Gonstead system or the this or that. And they're not really teaching the biomechanics of manipulation. And that's where it's a biomechanical function. And it's extremely important that you know how to palpate for accessory joint play movement. And Manel wrote a book on that with very little backup evidence. And so it remains for us. And that's why I'm so excited about the Danish Pragmatic study, because it's actually going to deal with hip dysfunction in the low back community. And then we keep reading about low back pain. Well, what is it? Well, then they've come up with this non-specific low back pain. I've never seen a case of non-specific low back pain. I can always diagnose somewhere in the closed kinematic chain that's setting up the irritation, usually facilitation, of the nervous system and the site of the nociception. So it's boggling my mind that chiropractic, AECC now has a physiotherapist as its president. Well, how in the hell does that happen? I just hope, as I said in the book, I just hope she has a really good head of the manipulation department. However, when I go to England, I find out they want to change the brand, and they're really going into rehabilitation, which to me is physical therapy. Now, the irony of this is that Pittsburgh University physiotherapy department have put in a motion X-ray study, and they're studying manipulation, actually visualizing what we do. And it's incredible. And so we're throwing away what is unique about us, and we're not taking the time as students to really learn the art of manipulation. And when they graduate, they don't realize that it's a postgraduate project they need to do. Now, when I graduated, I knew the manipulation. I didn't know much else. So my postgraduate project was up to London buying 1,500 pounds worth of textbooks and finding out what the hell I was doing. We got to get the two together. And that's the saddest part of what I'm observing today. I mean, people can't lift an occiput anymore. They don't even do that. They don't even teach it anymore.
Keep those skills paramount. And And that's why again, I think this conversation is important and a great reminder for us all. And as we start to bring this to conclusion, I guess the question that also is on my mind is, you know, you have this incredible story in your book. You share, as you said, it's your journey. You share the stories around that. What motivated you to write this book? Why now?
Well, I knew that I had references to the philosophy and the concepts that I was talking about. I didn't have RCTs, but I had life experience as a busy, very busy chiropractor in my clinic in England. I even practiced in Australia for 3 months. I ran Jack Conder's practice in Bankstown. I was in Canada for 10 years. Probably my partner and I had the busiest practice in Canada, probably. And then I came to the US and I started MPI and grew a decent practice as well as that. So the reason I wrote the book is that students today aren't really being told the history of what it is. I mean, I met all those. I even heard a lecture by B.J. Palmer at CMCC, and I went to 2 of them. He lectured that night to the Upper Cervical Club, and I attended. But so I've heard them all. I've heard Logan. And I've visited. When I started MPI, I went to the college towns, and there were 125, 150 students coming out. And then the presidents would invite me and say, well, why are you getting so many people at your seminar? And I say, because you're not teaching them chiropractic, right? You're either in the old BS religion, I mean, above, down, inside out, universal intelligence to innate intelligence. That's a religious concept. There's no way you can research that. It's impossible. And that's what makes it. And then we weren't a cult because we weren't really controlling people like that. So it was a religion. And what did we have? We had patients who were believers, and we were trying to make them into believers. And I mean, that's just ridiculous. And then I came along and I said to students, hey, there's a science about this. It's called biomechanics. You don't even get taught it. There's a guy in Switzerland taking video films. Well, there were 16-millimeter films in those days. And he was showing all these movements and abnormal, disjunctive movements of the spine before and after manipulation. I mean, it was obvious from watching those movies that things weren't moving properly. And after the manipulation, they started to move. Well, then what does that obviously ask you to do? Find out where it's not moving, right? So motion palpation, unfortunately, is actually restriction palpation. You're feeling for the block, not the movement. And some physiotherapists have written long papers about the fallacy of motion palpation. It's only a couple of millimeters, blah, blah, blah. However, the neck should turn over to here and here. And if it can't, somewhere along the way, you're going to feel it's restricted. And then you're going to know at what level it is. And since manipulation is not vertebra specific, it's a number of joints. That's been shown. Kim Ross wrote a paper, he got his PhD. When we hear that one click, he put microphones on the spine, and he heard a series of clicks that our ear thought was one click. And so there's no such thing as a specific adjustment. So it doesn't matter if you're palpating 2, 3, and it's really 3, 4. And so the research about motion palpation was always that it had to be research specific, right? If you said it was 2-3, it had to be 2-3, and somebody else couldn't say it was 3-4. Well, it turns out it doesn't matter. And it's so clinically significant. If you're restoring function where there's dysfunction, patients start to respond. And if you have the ability to feel, and so they can feel the restriction, they'll start to feel that they can move, and they'll know what they got from you. And then if they get better, it's a causal thing that was corrected, and they started feeling better. There's no belief system here. My patients don't believe in me. They know that I can find restrictions, and I do manipulations that restore those restrictions. I test them after. How many chiropractors do a retest after they adjust? Not many. Well, how in the hell do you know what you clicked? And in what direction? And you know, there's three directions of motion around the 3 axes, X, Y, and Z axes. And every motion is a rotation around an axis. And the manipulation has to be around 1 or 2. Sometimes there's coupled motion and you can get 2 rotations out of 1 manipulation. But I often, at a motion unit or in a segment, I often do 4 or 5 or 6 manipulations around these different axes that are blocked. Well, boy, that blew everybody's mind. How can I see 100 people a day doing that? Well, you don't do it everywhere. You just do it where it's blocked, right? So the flying 7, I hated that, right? 2 lumbar rolls, a couple of cracks in the thoracic, a couple of rotations of the neck. And that was a treatment. Everybody got the same treatment. Right? That didn't make any sense to me. Why would a headache patient get the same as a low back patient? Anyways, this book, there's 268 pages of all these things that I found out, and I had pushback against, and who was pushing back, and why they were pushing back, and why colleges don't put my books in. They have them in the library, but they don't refer to them. They never say to a student, go and read Len Faye's old textbook that was written in '89, right? You probably don't even know it exists.
I do, because I got to see you when I was at Sydney College of Chiropractic, when you did come to one of those times within Australia. So I am aware,
Yeah.
and I'm grateful now for this book.
Well, I'm so happy you've invited me, because I hope some students are listening to this and get on board with what they need to know to be super busy. They're never going to be busy as a physiotherapist because they're a poorly trained physiotherapist. They don't know anything about rehabbing surgery, rehabbing brain surgery, rehabbing. I mean, a physiotherapist is very good at what they do. And we should be referring after we do our manipulation to them.
Not chiropractic.
Yeah.
Well,
and we don't need that. It gets lousy results if there's fixations, we call them, in the spine or extremities that are driving the nociception, right? It's an adapted joint that's usually irritating and causing the nociceptive impulses.
So much to learn. There's so much wisdom in your book. There's so much of an opportunity to follow that history and to see.
Some guys are telling me they read the book 4 times.
I love that. Well, I think that means we're going to have you back for another conversation and to share this message even further. Dr. Leonard Faye, I thank you so much again for your time today, for the message. And I'd love to have you back. It's been a pleasure.
I love being invited to Australia. I'm only 83, so I've still got some kick in me. And
And that's how it
Yeah.
should be. Thank you very
Uh,
much.
read
So
the
grateful
book.
for you, for your message. Everybody, grab the book, take that journey, and let's learn the principles of chiropractic and biomechanical and
Thanks.
functional neurology. Thank you.
Thanks for the interview. Bye now.